Over 60? This drug is quietly destroying your heart health. Have you ever wondered why your energy levels plummeted after turning 60, even though your doctor says your blood pressure medication is working perfectly? Have you noticed that climbing stairs leaves you breathless, that your ankles swell by evening, or that your heart sometimes feels like it is skipping beats for no apparent reason? You are not alone in this struggle, and what I am about to share with you might explain everything you have been experiencing. Millions of Americans over 60 are unknowingly taking a medication that their doctor prescribed with the best intentions. But this same drug is slowly and silently damaging their heart health in ways that most people never connect to their daily pill routine. The frustration you feel when you follow every medical recommendation, take your medications exactly as prescribed, maintain a reasonable diet, and yet still feel like your cardiovascular health is declining, is not in your imagination. There is a hidden culprit that could be undermining everything you are doing right, and the worst part is that this information is rarely discussed in typical doctor visits. Today, I want to share with you the eye-opening research that reveals how certain commonly prescribed medications can actually weaken your heart muscle, disrupt your natural cardiovascular rhythms, and accelerate the aging process in your circulatory system. More importantly, I am going to show you specific science-backed strategies that can help protect your heart, restore your energy levels, and potentially reverse years of hidden damage, all using natural approaches that work alongside your current medical care. Imagine waking up each morning feeling genuinely energetic again, being able to walk up those stairs without getting winded, and having the confidence that you are actively strengthening your heart instead of unknowingly weakening it. This is not just wishful thinking, this is the reality that thousands of people have experienced when they discovered what I am about to share with you. Before we dive deeper into this crucial information, I want you to do something that could literally change your heart health trajectory. Hit that like button right now to help more people over 60 discover this potentially life-saving information, and make sure to subscribe to this channel, because I share breakthrough health discoveries like this every week. Most importantly, please check the first link in the description below, right after this video, where I will show you a powerful natural supplement that has helped thousands of people protect their hearts and accelerate their recovery from medication-related cardiovascular damage, up to 2 times faster than diet and exercise alone. The medication I am talking about is not some obscure drug that only a few people take. In fact, if you are over 60 and have been diagnosed with high blood pressure, high cholesterol, diabetes or arthritis, there is a very strong chance that you are taking this type of medication right now. The class of drugs I am referring to includes proton pump inhibitors, commonly known as PPIs, which are prescribed to millions of older adults for acid reflux, heartburn and stomach protection. These medications have names like omeprazole, esomeprazole, lansoprazole, and pantoprazole, and they are some of the most frequently prescribed drugs in America. Your doctor may have given you one of these medications to protect your stomach while you take other drugs, or to treat persistent heartburn that seems to worsen with age. The problem is that while these drugs do effectively reduce stomach acid production, they also create a cascade of nutritional deficiencies that directly impact your cardiovascular health. When your stomach cannot produce adequate acid, your body struggles to absorb crucial heart-supporting nutrients like vitamin B12, magnesium and iron. Vitamin B12 deficiency leads to elevated homocysteine levels, which damage the lining of your arteries and increase your risk of blood clots. Magnesium deficiency disrupts your heart rhythm, contributes to muscle weakness, and impairs your body's ability to regulate blood pressure naturally. Iron deficiency reduces your blood's oxygen-carrying capacity, forcing your heart to work harder to pump blood throughout your body. These deficiencies develop gradually over months and years of PPI use, which is why the connection between your medication and your declining energy levels or cardiovascular symptoms is rarely obvious to you or your healthcare provider. Research published in the Journal of the American Medical Association tracked over 140,000 people taking PPIs, and found that long-term use was associated with a 25% increased risk of heart attack, even in people who had no previous history of heart disease. Another comprehensive study involving more than 290,000 participants revealed that PPI users had a significantly higher risk of developing heart failure, and this risk increased the longer the medications were used. The mechanism behind this increased cardiovascular risk involves more than just nutritional deficiencies. PPIs interfere with the production of nitric oxide, a crucial molecule that helps keep your blood vessels flexible and responsive. When nitric oxide production decreases, your arteries become stiffer, your blood pressure rises, and your heart must work harder to pump blood efficiently. Additionally, these medications can disrupt the balance of beneficial bacteria in your digestive system, leading to increased inflammation throughout your body, including inflammation that affects your heart and blood vessels. Now, I want to pause here and ask you something really important. Do you ever feel like no one truly understands what you are going through with your health concerns? Do you sometimes feel isolated in your struggle to maintain your vitality and energy as you age, especially when others around you seem to dismiss your symptoms as just getting older? I want you to know that I see you, I understand your frustration, and you are not alone in this journey. If this resonates with you, please take a moment to comment below and simply write "I understand, my heart health matters," This simple act of writing those words serves two important purposes. First, it helps you acknowledge that taking charge of your cardiovascular health is a priority worth pursuing, and second, it connects you with a community of people who are on the same journey toward better health. When you share your experience in the comments, you not only validate your own health journey, but also provide encouragement to others who might be reading and feeling exactly the same way. Your voice matters, your health matters, and together we can create a supportive environment where people feel empowered to make positive changes. Now, let me continue sharing these life-changing strategies that can help protect your heart health. The first natural approach to protecting your heart while managing medication-related risks involves supporting your body's absorption of critical nutrients that PPIs can deplete. Magnesium plays a fundamental role in over 300 enzymatic reactions in your body, with many of these directly related to cardiovascular function. When you are deficient in magnesium due to long-term PPI use, you may experience irregular heartbeats, muscle weakness, fatigue, and difficulty controlling blood pressure. The most bioavailable forms of magnesium for heart health are magnesium glycinate and magnesium taurate, with an optimal daily intake ranging from 400 to 600 milligrams for most adults over 60. Magnesium taurate is particularly beneficial because it combines magnesium with the amino acid taurine, which independently supports heart rhythm and helps protect against oxidative damage to heart muscle cells. Clinical studies have shown that people who maintain adequate magnesium levels have a 22% lower risk of developing heart disease compared to those with chronic magnesium deficiency. If you are currently taking a PPI medication, consider having your magnesium levels tested through a red blood cell magnesium test, which is more accurate than the standard serum magnesium test that most doctors order. Vitamin B12 deficiency caused by PPI use creates a particularly dangerous situation for your cardiovascular health because it leads to elevated homocysteine levels in your blood. Homocysteine is an amino acid that, when present in high concentrations, damages the inner lining of your arteries and promotes the formation of blood clots. People taking PPIs for more than 2 years often develop B12 deficiency that goes undiagnosed because the symptoms, including fatigue, memory problems, and balance issues, are frequently attributed to normal aging. The active form of vitamin B12, called methylcobalamin, bypasses the absorption problems caused by reduced stomach acid and can be taken sublingually, meaning under the tongue, for direct absorption into your bloodstream. A therapeutic dose of 1,000 to 2,000 micrograms of methylcobalamin daily can help restore healthy B12 levels and reduce homocysteine to protective ranges. Research from the New England Journal of Medicine demonstrated that people who maintained healthy B12 levels and normal homocysteine had a 32% lower risk of stroke and a 19% lower risk of heart attack compared to those with B12 deficiency. Iron deficiency anemia is another serious consequence of long-term PPI use that directly impacts your heart health, though many people do not realize the connection between their medication and their increasing fatigue and shortness of breath. When your stomach acid levels are suppressed, your body cannot effectively absorb iron from food sources, leading to a gradual depletion of iron stores over time. Iron deficiency forces your heart to pump faster and work harder to deliver oxygen to your tissues, which can lead to an enlarged heart, irregular rhythms, and increased risk of heart failure. The type of iron supplement you choose matters significantly for absorption and tolerability. Chelated iron, such as iron bisglycinate, is gentler on the digestive system and more readily absorbed even when stomach acid levels are low. A typical therapeutic dose ranges from 25 to 65 milligrams of elemental iron daily, but this should always be determined based on laboratory testing that includes ferritin levels, which indicate your body's iron stores. Combining iron supplementation with vitamin C-rich foods or supplements enhances absorption, while avoiding coffee, tea, and calcium supplements within 2 hours of taking iron maximizes its effectiveness. Please take a moment right now to like this video if you are finding this information helpful, and make sure you are subscribed so you do not miss future videos where I share breakthrough health discoveries that can transform your quality of life. Coenzyme Q10, commonly referred to as CoQ10, represents one of the most powerful natural compounds for protecting your heart against medication-related damage and supporting overall cardiovascular function. Your heart muscle contains more mitochondria, the cellular powerhouses that produce energy, than almost any other tissue in your body, and CoQ10 is absolutely essential for optimal mitochondrial function. As we age, our natural production of CoQ10 declines significantly, and certain medications, particularly statins and some blood pressure medications, can further deplete our CoQ10 levels. When CoQ10 levels are insufficient, your heart muscle cannot generate the energy it needs to pump effectively, leading to fatigue, shortness of breath, and increased risk of heart failure. The bioavailable form of CoQ10 is called ubiquinol, which is the reduced active form that your cells can immediately utilize. Research has consistently shown that supplementing with 100 to 200 milligrams of ubiquinol daily can improve heart function, increase energy levels, and provide powerful antioxidant protection against free radical damage to heart muscle cells. A landmark study published in the journal Cardiology followed 420 patients with heart failure for 2 years and found that those who took CoQ10 supplements had a 43% reduction in cardiovascular deaths compared to the placebo group. For people over 60 who are taking multiple medications, CoQ10 supplementation can be particularly beneficial for maintaining heart muscle strength and supporting the cellular energy production that keeps your cardiovascular system functioning optimally. Omega-3 fatty acids, specifically EPA and DHA found in high-quality fish oil supplements, provide comprehensive cardiovascular protection that becomes increasingly important as we age, and especially when dealing with the inflammatory effects of certain medications. These essential fats help maintain the flexibility and responsiveness of your blood vessels, reduce inflammation throughout your cardiovascular system, and support healthy heart rhythm. The American Heart Association recommends at least 1,000 milligrams of combined EPA and DHA daily for people with existing heart disease, but many functional medicine practitioners suggest higher doses, ranging from 2,000 to 3,000 milligrams daily, for optimal cardiovascular protection. The quality and purity of fish oil supplements varies dramatically, so look for products that are molecularly distilled to remove contaminants and third-party tested for potency and purity. Triglyceride form fish oil is generally better absorbed than ethyl ester form, and taking fish oil supplements with a meal containing healthy fats further enhances absorption. Clinical trials have demonstrated that people who maintain optimal omega-3 levels through supplementation have a 25% lower risk of sudden cardiac death and significantly reduced rates of dangerous arrhythmias. Hawthorn berry extract represents one of nature's most effective heart tonics, with over 1,800 years of traditional use and extensive modern research supporting its cardiovascular benefits. This powerful herb contains flavonoids and oligomeric proanthocyanidins that strengthen heart muscle contractions, improve blood flow to the heart, and help normalize blood pressure. Hawthorn works particularly well for people experiencing the fatigue and reduced exercise tolerance that can result from medication-related heart muscle weakness. Standardized hawthorn extract, typically containing 1.8% phytixin or 18.75% oligomeric proanthocyanidins, provides the most consistent therapeutic benefits. Research dosages range from 160 to 900 mg daily, with most studies using around 450 mg taken in divided doses with meals. A comprehensive analysis of 14 clinical trials found that hawthorn supplementation improved exercise tolerance, reduced fatigue, and enhanced overall heart function in people with mild to moderate heart problems. The beauty of hawthorn is that it gently supports your heart's natural function without interfering with most medications, making it an excellent complementary therapy for people who need to continue taking prescribed drugs while supporting their cardiovascular health naturally. Garlic extract, when standardized to provide adequate levels of allicin, offers multiple cardiovascular benefits that can help counteract some of the negative effects associated with certain medications. Allicin, the active compound responsible for garlic's distinctive odor and many of its health benefits, helps lower blood pressure, reduces inflammation in blood vessels, and provides natural blood-thinning effects that can improve circulation. Aged garlic extract has been specifically studied for cardiovascular health and has been shown to reduce arterial plaque buildup, improve arterial flexibility, and lower markers of inflammation. The typical effective dose ranges from 600 to 1,200 milligrams of standardized garlic extract daily, equivalent to eating several cloves of fresh garlic. However, garlic supplements provide more consistent levels of active compounds without the digestive irritation that some people experience from eating large amounts of raw garlic. A 2-year study published in Atherosclerosis found that people taking aged garlic extract had significantly less progression of arterial plaque compared to those taking placebo, suggesting that garlic can help prevent the advancement of heart disease even in people already showing signs of arterial damage. Hibiscus tea represents an enjoyable and effective way to support healthy blood pressure and provide cardiovascular protection through natural compounds called anthocyanins and other flavonoids. Multiple clinical studies have shown that drinking hibiscus tea regularly can lower both systolic and diastolic blood pressure as effectively as some prescription medications, making it an excellent complementary therapy for people managing hypertension. The typical effective dose is equivalent to drinking 2 to 3 cups of hibiscus tea daily, or taking standardized hibiscus extract, providing 250 to 500 milligrams of active compounds. Hibiscus works by inhibiting ACE enzyme activity, similar to ACE inhibitor medications, but through natural mechanisms that do not typically cause side effects. The deep red color of hibiscus comes from powerful antioxidants that protect blood vessels from oxidative damage and help maintain the flexibility of arterial walls. Research published in the Journal of Nutrition found that people who consumed hibiscus extract for 6 weeks experienced an average reduction of 11 millimeters of mercury in systolic blood pressure and 6 millimeters of mercury in diastolic blood pressure. Potassium plays a crucial role in maintaining healthy blood pressure and supporting optimal heart rhythm, but many people over 60 do not get adequate amounts from their diet, and certain medications can further deplete potassium levels. Unlike sodium, which tends to increase blood pressure and fluid retention, potassium helps relax blood vessel walls and promotes the excretion of excess sodium through the kidneys. The optimal daily intake of potassium for cardiovascular health is around 4,700 milligrams, but most Americans consume less than half this amount. Food sources of potassium include avocados, spinach, sweet potatoes, bananas and white beans, but achieving optimal levels often requires conscious effort to include potassium-rich foods at every meal. Potassium citrate supplements can help bridge the gap, but it is important to work with a healthcare provider to monitor potassium levels, especially if you are taking blood pressure medications or have kidney problems. Research from the American Heart Association has shown that people who consume adequate potassium have a 20% lower risk of stroke and significantly reduced risk of developing high blood pressure as they age. Now I want to address something that might be weighing on your mind as you learn about these natural approaches to heart health. You might be wondering whether you should stop taking your prescribed medications or if these natural supplements will interfere with your current treatment plan. This is a completely understandable concern, and I want to be absolutely clear that you should never stop taking prescribed medications without working closely with your healthcare provider. The goal here is not to replace your medical care, but to enhance it with natural strategies that can help protect your heart and potentially reduce your dependence on medications over time as your cardiovascular health improves. Many of the supplements I have mentioned work synergistically with conventional medications and may actually help reduce side effects while enhancing the benefits of your prescribed treatments. However, certain combinations require monitoring, particularly if you are taking blood-thinning medications, blood pressure drugs or diabetes medications, because some natural supplements can enhance the effects of these drugs. This is why I always recommend working with a healthcare practitioner who understands both conventional medicine and natural therapies, someone who can help you create an integrated approach that maximizes your health outcomes while ensuring your safety. The timing of when you take supplements in relation to your medications can significantly impact their effectiveness and safety. For example, if you are taking a PPI medication, you should take iron, vitamin B12, and other supplements that require stomach acid for absorption at least 4 hours away from your PPI dose, preferably before breakfast if you take your PPI at dinner, or vice versa. Magnesium supplements can enhance the absorption of many nutrients, but may interfere with certain antibiotics and should be taken at different times. Fish oil supplements are best absorbed when taken with meals containing other fats, which also helps reduce any potential digestive upset. CoQ10 is fat-soluble and should also be taken with meals, preferably earlier in the day since some people find it energizing and it might interfere with sleep if taken too late. Creating a supplement schedule that optimizes absorption while preventing interactions requires some planning, but the effort is well worth the cardiovascular benefits you will experience. Dietary modifications can significantly enhance the effectiveness of supplements while providing additional cardiovascular protection that medications alone cannot offer. The Mediterranean diet pattern, rich in olive oil, fish, vegetables, fruits, nuts and whole grains, has been extensively studied and consistently shows powerful heart protective effects. This eating pattern naturally provides many of the nutrients that medications can deplete while delivering anti-inflammatory compounds that support overall cardiovascular health. Reducing processed foods, refined sugars and trans fats while increasing fiber-rich foods helps maintain healthy blood sugar levels and reduces inflammation, both of which are crucial for long-term heart health. Including fermented foods like kefir, sauerkraut and kimchi can help restore the beneficial bacteria that PPI medications often disrupt, which in turn supports better nutrient absorption and reduces systemic inflammation. Staying adequately hydrated with pure water throughout the day helps your kidneys function optimally and supports healthy blood pressure, while limiting alcohol to moderate amounts prevents additional stress on your cardiovascular system. Exercise represents one of the most powerful tools for protecting and strengthening your heart, but the type and intensity of exercise that is most beneficial may be different than what you might expect, especially if you are dealing with medication-related fatigue or reduced energy levels. Rather than pushing yourself through high-intensity workouts that might leave you exhausted, focus on consistent, moderate-intensity activities that you can sustain long-term. Walking for 30 to 45 minutes most days of the week provides significant cardiovascular benefits and can be easily adjusted based on your current fitness level and energy. Resistance training with light to moderate weights helps maintain muscle mass and supports healthy metabolism, both of which contribute to cardiovascular health. Yoga, Tai Chi, or other gentle movement practices provide the added benefits of stress reduction and improved flexibility while still supporting heart health. The key is consistency rather than intensity, and finding activities that you genuinely enjoy increases the likelihood that you will stick with your exercise routine long-term. Stress management deserves special attention because chronic stress contributes to inflammation, elevated blood pressure, and increased risk of heart rhythm problems, all of which can compound the negative effects of medications on your cardiovascular system. Techniques like deep breathing exercises, meditation, or progressive muscle relaxation can activate your parasympathetic nervous system, which promotes healing and recovery while reducing stress hormones that damage your heart and blood vessels. Even simple practices like spending time in nature, listening to calming music, or engaging in hobbies that bring you joy can provide significant cardiovascular benefits by reducing chronic stress levels. Sleep quality also plays a crucial role in heart health, and many people over 60 experience sleep disruptions that can be related to medications, nutrient deficiencies, or other health issues. Creating a consistent bedtime routine, maintaining a cool, dark sleeping environment, and avoiding screens for at least an hour before bedtime can significantly improve sleep quality and support cardiovascular recovery. Regular monitoring of key health markers allows you to track your progress and make informed decisions about your supplement and lifestyle protocols. In addition to standard tests like blood pressure, cholesterol panels, and blood sugar levels, consider asking your healthcare provider about tests that can reveal nutrient deficiencies and inflammatory markers. A comprehensive metabolic panel, complete blood count, and tests for vitamin B12, vitamin D, magnesium, ferritin, and high-sensitivity C-reactive protein can provide valuable insights into how your body is responding to your health improvement efforts. Homocysteine levels are particularly important to monitor if you have been taking PPI medications, as elevated homocysteine is a strong predictor of cardiovascular risk that is often overlooked in routine medical care. Some people also benefit from advanced testing like coronary calcium scoring or carotid artery ultrasound to assess their current level of arterial health and track improvements over time. The journey to optimal heart health after 60 is not about perfection but about making consistent, informed choices that support your cardiovascular system while working with your healthcare team to manage any necessary medications safely. Every positive change you make, whether it is adding a heart-healthy supplement, choosing more nutrient-dense foods, or taking a daily walk, contributes to your overall cardiovascular well-being and can help counteract some of the negative effects that certain medications may have on your heart health. Remember that your body has remarkable healing capacity when given the right tools and support, and many people have successfully improved their heart health significantly even after years of taking medications that may have contributed to cardiovascular problems. As we wrap up this important discussion about protecting your heart health, I want you to know that taking charge of your cardiovascular well-being is one of the most empowering things you can do for yourself and your loved ones. The information I have shared today represents years of research and the real-world experiences of thousands of people who have successfully improved their heart health using natural approaches alongside their medical care. You deserve to feel energetic, vital, and confident about your cardiovascular health, regardless of your age or current health status. If this video has provided valuable insights that could help improve your heart health, please take a moment to give it a like and share it with someone who might benefit from this information. Your engagement helps this content reach more people who need to understand how to protect their hearts while managing necessary medications. Make sure you are subscribed to this channel and hit the notification bell so you do not miss future videos where I continue to share breakthrough health discoveries and practical strategies for aging with vitality and strength. Most importantly, please check the first link in the description below, right after this video, where I will show you a powerful natural supplement protocol that has helped thousands of people protect their hearts and accelerate their recovery from medication-related cardiovascular damage up to 2 times faster than diet and exercise alone. This is not just about adding years to your life, but about adding life to your years, ensuring that your heart remains strong and healthy so you can continue enjoying all the activities and relationships that bring meaning to your life. Remember, your health journey is unique, and you have the power to make choices that support your cardiovascular well-being every single day. Take that next step toward optimal heart health because you deserve to feel your absolute best for many years to come.